Good evening and welcome everyone for our English session. Today is our 1027th webinar session. Really, it's a great success for IFPH because every day we are growing. IFPH is growing every day. That is because of your participation, your encouragement, your enthusiasm. So I'm really thankful to all the participants for joining with us and encouraging us. Thank you so much. And today we got a legend from Pakistan, that is JAVED AKTHER, and he is BHMS and BSc in Clinical Pathology, MPhil in Physiology, and is a member of National Council for Homeopathy in Pakistan and chairman of Professional Development Program of Homeopathy. And he is a mentor and he has many years of teaching experience. And today he is discussing about cancer treated with a homeopathic single dose of medicine. And I'm welcoming Dr. JAVED AKTHER. Thank you so much for joining with us. Sir, please welcome.
First of all, thank you to all of you and all the, especially IFPH and all the well-wisher of homeopathic. So I'm grateful to IFPH team who introduced the worldwide homeopathy, and I'm really grateful for the joining the well-wisher and homeopathic doctors. Today I'm going to present a very beautiful case. Basically, today I have selected the case which is the milestone for the homeopathy, and it is the aggressive cancer which was being treated by single remedy, single homeopathic medicine. That is a significant because as most of the people are saying that homeopathy is treating the cancer, but the evidence is not clarity over there. So I'm going to give the with evidence with patients. It will give you the full confidence on the homeopathy. So I'm going to present, please. So this is my introduction, please. A successful treatment of T-cell lymphoblastic lymphoma with arsenic album using Segel method, a case report. This is a case report present the successful treatment of a 22-year-old male patient suffering from T-cell lymphoblastic lymphoma, a type of non-Hodgkin lymphoma, using a single homeopathic medicine, arsenic album, based on Segel's method. The treatment approach involved perceiving specific gestures, words, or expression used by the patient, guided by the presence, persistent, predominant, and concern, triple P. The present, persistent, predominant, and CR, concern adaptation reaction framework. The patient exhibited symptoms such as left-sided paralysis, convulsions, and swelling of the cervical glands. Remarkably, the patient showed significant improvement within a week of treatment with complete resolution of the aforementioned complaint. This case report highlights the potential efficiency of individualized homeopathic treatment in addressing lymphoma symptoms and encourage further research exploration of homeopathic approach in cancer treatment. The primary, what is the difference between Hodgkin and non-Hodgkin lymphoma? The primary difference between Hodgkin and non-Hodgkin lymphoma is a type of lymphocyte that affected. Hodgkin lymphoma is marked by presence of Reed-Sternberg's lymphocyte. This is the only difference between Hodgkin and non-Hodgkin lymphoma. In Hodgkin, the Reed-Sternberg's lymphocyte are present, and in non-Hodgkin lymphoma, they are not present. Both are the cancers. What is the introduction of this T-cell lymphoblastic lymphoma is a rare and aggressive form of non-Hodgkin lymphoma that primarily affects young individuals. Homeopathic treatment has shown promising results in various malignancies, including lymphoma. Second method based on perceiving specific patient expression has been utilized for individualized homeopathic prescription. Case presentation. A 22-year-old male patient presented with the diagnosis of T-cell lymphoblastic lymphoma. He complained of left-sided paralysis, convulsion, and swelling of cervical glands. Second method was employed to identify the most suitable homeopathic medicine, and arsenic album was prescribed based on patient's unique expression and gestures. Symptom of the patient of T-cell lymphoblastic lymphoma. Symptom of the patient with T-cell lymphoblastic lymphoma, which is type of non-Hodgkin lymphoma, can vary based on information provided. Here are some potential symptoms associated with condition. Enlarged lymph nodes, paralysis on the left side, severe fits or epileptic fits, fatigue, recurrent or persistent fever, weight loss, respiratory symptoms. These are the symptoms of the patients. Basically, these are the complaints. This is the report, finding report of the patients. That is cervical biopsy was taken over there. The report was taken well established and well-known hospital, a cancer hospital. Cervical lymph node HCN biopsy was taken. Here it was diagnosed T-cell lymphoblastic lymphoma. This is a post-contrast MRI brain. Here, it was not attacked to other side of the brain and other things. Only this can present over there. Here, the findings of these patients. Please. Department, yes, CT scan report. Here is a conclusion of numerous enlarged lymph nodes lie with the hollow diagram. This is a CT scan report of the patient. CT scan report of the patient, and then different reports, but it was diagnosed in biopsy. Fine needle aspiration of the right cervical lymph node. Here it was aspirate an atypical lymphoid cellular infiltrate. And all other reports are the HIV negative and hepatitis B, C negative. There are the other tests, routine tests are here. Patient, now I'm come to the homeopathic point of view. What was the expression of the patient version? What was the version of the patient? Basically, that is count to be in homeopathy. What was the gestures? What was the version of the patient? Case of young man Hamza of age 22 years. Patient was lying on bed with left-sided paralysis, who is coughing in pauses and is almost dependent on IPR. So doctor asked, yes, please tell me what the problem. Such small tumors appeared in my neck, which slowly started increasing in numbers, due to which I went to renowned hospital. They took biopsy for laboratory test. After that, I was referred to Anmol Hospital, where they took some CSF, cerebrospinal fluid, with injection from my spine, and MRI was done. I think that was the time when main problem started. One side of my body become completely numb, and then doctor asked, before how long you are suffering with this all? It's almost 2 months before it got severe. What happened 2 months? Nothing special. What is your job? I had a mobile shop which was unable to run, and I left that. Doctor, any problem of that shop related issue? No, not at all. Doctor, then what did you leave that? I didn't have experience to run, so I left that. Doctor, what all are there at your home? Who all are at your home? Brother, sister, mom, and papa. Basically, this is a very beautiful question. If you ask the patient, who are all there at home? घर में कौन कौन होता है? The patient's reply be brother, sister, mom, and papa. This is the basically this is a sequence of the patient. What is the tension in your life? No tension at all. Everything is fine. What is the concern about your suffering? One side of my body is numb, convulsion off and on, which are uncontrollable. My eyes move to either side, which are not in my control. And any fear or something like that? No, no, sir. What about anger? I don't have any anger. Okay. If that's the situation, then please tell me what's coming in your mind if you are left with the same situation. Anything comes in your mind? Yes. One thing I feel that when it will end up, when it will finish the disease. Why you think like that? Because due to this, my mom and papa are disturbed due to me. Okay, please elaborate it. Why are you saying this? I am young man. I have to serve my parents, but instead of that, they are giving me services. They have took after me. Patient start weeping when he was saying such thing. During problem, what do you do or demand? I demand that someone press my legs and arms and other parts of my body. What do you want now? I want that this should come now, end up as soon as possible, even within 2-3 days. I like to walk myself. I want to be independent because I am dependent. Doctor, do you want not to dependent? Do you mean that? Yes, I don't want to be dependent. I regret to depend on my parents. I want to look after them at this stage, but instead they are looking after me, which I feel bad. Doctor, what do you want to do and what not to do? I want to walk independently like before, because I used to walk to the medical store to fetch medicine. I want again to be like that. Okay. Does it mean that you don't want to become burden on others? Yes. If you don't have any concern of this, then why you came to doctor? I don't have control over these convulsions. Observation, which I have seen the patient. At sudden convulsion started in my clinic from left side of the body, then right side of the body. Duration about 5 minutes. Right and left cervical glands are swelling. This is a patient.
Shut the hell up, boy. You suck at reading. Get the fuck out of here, bitch. You fucking bitch ass boy. Ain't nobody like you, boy. You ain't gonna be shit in life reading. You don't even know how to read, boy. You don't even know how to read.
Where is the voice?
You suck at reading. Stop trying to mute me, boy. You suck, boy. Get out of here, boy. Bitch ass boy. Get trolled, boy. That's why you don't post your link on Twitter, boy.
Excuse me.
Excuse you.
Mute, please.
I was trying to mute, but
you just said my cock. You just said my cock.
Hey.
Yeah. You ain't hacked, boy. You posted. You're not getting hacked. You're literally not. You posted the link on Twitter. You
Hello,
literally posted
what
the
are you
link.
doing? Hello,
I'm trying to let you know. Don't post the link on Twitter.
what?
Do not post the link on Twitter. Everyone can join it. Every single person in the world. Do not
Please.
post the link on Twitter. Twitter will fuck
Please,
you up.
I'm trying to mute you. Then again, you are unmuting. We are taking the classes, right?
I
Who are
know.
you?
Get the turn. Okay, delete the Twitter. Delete.
Who are you?
Delete the Twitter link. Or anybody can just show up in here. Delete the Twitter link. People can just search it up on Twitter.
What do you mean the Twitter link? I don't.
Whoever made this meeting.
Okay.
I think it's hacked.
Yeah, doctor, please continue.
Okay, thank you, please.
I removed him.
This is a patient version. Patient is suffering from left side paralysis. And now it's also suffering from the epileptic convulsion. You can see this patient. It was started again and right side. So at first time it was left sided. Now it's right side. Okay, thank you, please. If this is an analysis of the patient, which I'm going to explain here, following rubrics are I've taken over there. I'm going to explain each rubric. Rubrics are the first rubric, careless being desired to be caressed, crying, weeping, hopelessness from, carry desire to be carried, fast. Gesture makes tics nervous, unconscious convulsion after epileptic, wears of burden feeling, independent cannot be, worries tendency to daily cares affected by cares for a relative about love family per bad aversion to shuns them. Now I'm going to explain this. What is the meaning of these rubric? During this problem, according to the version of the patient, during problem, what do you do or demand? Patient, I demand that someone press my legs and arms and other parts of my body. So I took the rubric caressed being desired to be caressed. This rubric implies that the remedy may be appropriate for individuals who have an intense longing to receive physical touch, warmth, or love. They may seek out an opportunity for physical closeness and find comfort in being physically cared for and nurtured. And second rubric, the version of the patient, I am young man, I have to serve my parents, but instead of that they are giving me service. They have to look after me. Patients start weeping. At that time, I have took the rubric crying, weeping, hopelessness from. Basically, patient was hopeless. Individual who experience crying or weeping, boots rooted in the state of hopelessness, the tear and emotional release may be accompanied by a profound sense of loss of hope, either by ceasing to hope for an outcome, hopelessness, or feeling trapped and a belief that there is no way out of their situation. Another version of the patient, what do you want to know? What do you want now? I want that this should now end up as soon as possible, even within 2 or 3 days. So, according to this version, I took the rubric, carry desire to be carried fast. What is the meaning of this rubric? Implies that the remedy may be appropriate for individuals who have a strong urge to lifted and carried at the swift pace. This may experience a sense of excitement, comfort, or security with being carried rapidly. Fast means suggests that it may be also be considered for individuals who have a specific preference for being carried quickly. And observation of when I observed the patient, a sudden convulsion started in my clinic from left side of the body, then right side of the body, duration about 5 minutes. So I took the rubric here. Gesture makes tics nervous. Gesture makes, it was a body gesture. That's tics means that convulsion. What is the meaning of this rubric? In homeopathic remedy suggests the person exhibiting nervous tics or involuntary movement of the repetitive nature. This rubric indicates that the individual may be displayed gestures or physical movement that are uncontrollable, repetitive, and related to the nervous or anxious state of mind. And second observation, sudden convulsion started in my clinic, left side of the body, then right side, duration 5 minutes, no awareness of convulsion after. Any patient convulsion, no awareness, it was gestures. The patient was not aware about convulsions. Unconscious rubric is taken over here. Unconscious convulsion after epileptic. The rubric provides insight into the mental state of the person following an epileptic seizure. The person loses consciousness after an epileptic seizure or experience unconsciousness or mental fog following an epileptic seizure. The patient was not aware what was happened to him. During the convulsion, he didn't remember it. This is the meaning of this unconscious convulsion after epileptic. What I asked the patient, what happened before this? The patient say, I don't know what happened to me. And another version, I am young man, I have to serve my parents, but instead of that, they are giving me service. They have to look after me. Mind, the rubric is mind wears and burden feeling. Individual, it is an approach of the mental state of the patient, which I am the burden. Individuals who have delusion or imaginative thought that their life is burdensome or overwhelming, this may perceive the responsibility, challenges, and circumstances as an unbearable weight or hardship. Another version of the patient, I want that this should now end up as soon as possible, even in 2-3 days. I like to walk myself. I want to be independent because I am dependent. Patient, I don't want to be dependent. I regret to be dependent on my parents. I want to look after them at this stage, but instead they are looking after me, which I feel bad. So I took the rubric here, independent cannot be. What is the meaning of this rubric? Interpretation of term independent. This context of arsenical one, it suggests that remedy may be considered for individuals who have a strong desire for self-reliance, autonomy, or independence. These individuals may struggle with feeling of dependency or feel unable to be independent, possibly due to their physical or mental condition. This is the meaning of this rubric. Patient, another version, patient, I am young man, I have to serve my parents, but instead of that, they are giving me service, they have to look after me. I don't want to be dependent, I regret dependent on my parents. I want to look after them at this stage, but instead they are looking after me, which I feel bad. I want to walk independently like before, because I used to walk to the medical store to fetch medicine. I want again to be like that. What is tendency to daily cares affected by? So I took the rubric here. What is tendency to daily cares affected by? Suggested The remedy may be considered for individuals who have a propensity to worry excessively about their daily responsibility, obligation, and cares. They may have a perfectionist nature and fear that things will go wrong if they don't attend to every detail. This is the mindset of the arsenic album. The rubric is here. Another rubric, mind careful of relative about. Interpreted arsenic album in context, a rubric, mind careful of relative about, suggests that remedy may be considered for individuals who experience overwhelming cares or concern for the welfare of their relative. They may worry excessively about the health, safety, happiness, and success of their family members who are close relationships. Actually, one thing which IPR told me, basically when the patient was suffering from such a chronic aggressive disease, everyone left their job, everyone over there, everyone is going to with the hospital. Definitely, this patient was careful relative about. Another rubric, interpreting a love family birth. This is I took under the observation of all the symptoms. Basically, patient love family birth implies that the remedy may be prepared for individuals who deeply care for the value of their family relationship. They may patronize the well-being and happiness of their family members and derive significant sense of purpose and fulfillment for their family connection. Mind bed aversion to shuns bed. What is the meaning of this rubric? Interpreting arsenic album in the context of the rubric, mind bed aversion to shun the bed, suggests that remedy may be considered for individuals who have a strong aversion to avoidance toward going to bed. They may experience restless anxiety, discomfort associated with being in bed, which may lead them to actively shun or resist the idea of sleeping or resist in bed. Mind self-control loss of. Arsenic element context of rubric, complete repertory. I took the rubric, self-control loss suggests that remedy may be considered for the individual who experience difficulty in maintaining self-control. They may struggle with impulse behavior, emotional outbursts, or racing thoughts. They may find challenging to manage or regulate. So now this is the chart. I'm going to show you again. This is a chart. If I took the first three rubric, carriage desire to be carriage, crying with hopelessness, carried desire to be carried, arsenic album comes in 4, 1, 2, 3, 4, where some burden feel unconscious convulsion after. These 4, 1, 2, 3, 4, 5. 5 rubrics I placed over here, arsenic album comes in. Okay, then you can see over there in the chart, this is a radar opus apex, and there is no near, very far are the other. Remedy and potency. I have selected the remedy only 1M, centimal scale, single. Arsenic album, single, arsenic album, single. I have given the patient at the spot. After the 1 day, you can see the patients with the at this patient moving their fingers of left, and patient says, I am feeling better. And one movement of the only feet, left side, you can see over there after 1 day. And another thing that is very important and predominant here, the patients after 1 day, patient was telling me that I have no convulsion episode after that medicine. This is very important. No convulsion, and patient was moving after 1 day left side of the finger and also left side of the finger of the feet. Follow-up of 2nd day. Now this patient can moving the left hand, and also moving the left leg. Yeah. Okay. This is a third day follow-up. Patient now can turn their position. No epileptic convulsion over there. This is a 4-day follow-up. You can see this patient. Now patient's the left side paralysis and convulsion all was disappeared after the first day, and patient is walking staggering gait like, but not completely properly walking, but patient walking. Now this is the 7th day of the patient. Patient comes with the stick at my clinic. One week. Patient didn't complain anything. Is the time count? Now I'm going to, after the 2nd week, at 2nd week, no stick is there. 2 weeks. This is the 3rd week. Any kind of complaint I asked, patient told me that I have no complaint. And after 5th week, no body swelling, no cervical lymph node are swelling. Every cervical lymph node was disappeared completely. No cough, no fever, no headache, and nothing, any kind of single complaint. Patient is taking normal diet. No swelling. I have checked thoroughly. This is the 6th week of the patient. Now, I have watched at least 10 weeks the patients. The successful outcome observed in this case suggests that the potential effectiveness of the homeopathic treatment, particularly with individualized using Segal's method, arsenic album, a well-known homeopathic medicine, demonstrated its therapeutic potential in addressing the specific symptom and manifest the T-cell lymphoblastic lymphoma. Further research and larger studies are warranted to validate these findings and explore the mechanism of action underlying such homeopathic intervention. Now I'm going to tell you, this is the Segal protocol. Here I have took the some I cross-confirmed by the confirmed that the chart of my arsenic album it is according to the right way or not. It was cross-checked by the classical therapeutic methods. Basically, it is a definitely aggressive cancer-like disease. So when I was deciding should I take the the chart and the case is correct or not according to this. And cross reference of this I'm going to show here. If you see the chart of this radar opus apex of the repertory, I took the rubric cancer, lymphoma, lymphatic glands, cancer, lymphoid leukemia, only 2 medicine, sarcoma. Only arsenic album and arsenic iodide. Another rubric, general cancerous affection, lymphoma, there are 26 medicine. And clinical symptom of Hodgkin disease, there's 6 medicine. Hodgkin disease, 6 disease. These are the general Hodgkin disease. There are different repertories and different authors who hematological disorders, Hodgkin disease, plan of action remedies, only 2 medicine. There's one single medicine, only single. Hematological disorders, disease, plans of action, only arsenic album. Here, all the repertories, all the authors and Materia Medica. And on the classical therapeutic point of view, I took here that they are saying that the arsenic album is one of the major choice of the medicine. Here, arsenic album. And arsenic, second number, arsenic iodide and others. However, I have decided on the basis of single protocol. So this case, basically, I'm going to show here. The case reports highlights, discussion, the successful outcome observed in this case suggests that the potential effectiveness of homeopathic treatment, particularly with individualized using cycle method, arsenic album, a well-known homeopathic medicine, demonstrated its therapeutic potential in addressing the specific symptom and manifestation of T-cell lymphoblastic lymphoma. Further research and larger studies are warranted to validate these findings and explore the mechanism of action underlying such homeopathic medicine. This case, this is the conclusion. This case report highlights the successful treatment of T-cell lymphoblastic lymphoma using arsenic album in accordance with cycle method, the prompt and significant improvement observed in the patient symptoms and provide insight into the potential benefits of individualized homeopathic prescription for cancer management. Further research and evidence-based studies are needed to substantiate these findings and expand the understanding of homeopathic interventions in lymphoma treatment. Thank you so much.
Thank you, Dr. Javed Akhtar. It was excellent presentation, and every day we are seeing many miracles here in IFPH. Many legends are sharing their experience. Actually, this is evidence-based. So we can show to anyone, those who are arguing with us, homeopathy is not evidence-based. They are arguing us like that. But now legends like you are proving that homeopathy is evidence-based. It's a great presentation. And now it is the time for discussion. Those who have questions, please raise the hand and ask question to Dr. Javed Akhtar. In the chat box, only the appreciations. Now, you have mentioned that when asking who are all at home, the patient said brother, sister, mama, and papa. Why? What do you?
Okay. Why this patient said, why arsenic album? Basically, normally arsenic album have a perfectionist, number one. It always used to say orderly, one thing.
Oh.
Normally patient says father, mother, and brother and sister. But one thing another is, the patients in arsenic album used to say where feel insecurity. But the main keynote of the Arsenic album, insecurity, is a top of there. I'm going to very beautiful examples of this. I have one patient who visited me. He said, where you, in suffering condition, where you want to live. Patient said, I want to live in my daughter's house. Why? Because daughter gives me, or sons take me. Understand? Now you can understand it. His brother, who visited to me here, he was so caring person, his brother. So he took the first name as brother. And the patient said to me, and sister is also doing but first brother and sister. And then mother is caring. And last father. The more person who's caring, first name of that. The second and third and fourth. Who is caring most, that is the first name. This is a basically orderly update. Orderly, it is the order of the patients who are caring and according to the security issues. This is the main reply of the patient. Why he's saying, and you can query it, why you say took the name of the first brother and sister then, and mom with then father. So he gives you the proper reason this why I took that.
Did you ask like that or?
Yes.
Okay.
Yes, I asked it. Why? Because this is a very logical question. Why basically normally he should take a first name of the father and mother. This is a very important. I used to ask the patient how much your family members, and if he said, if another gives you, I'm going to give example. A patient or female visited to me, how many members in your family? She said, my brother-in-law, then other names. So I asked it, why should you take the name first brother? I asked, is it more caring? And she was start weeping. What happened? Actually, she said, this is the actual problematic for me. He used to follow. Okay. This is the basically manifest of the patient. You can. It is a very beautiful question because you don't know about the family of the patients. But if you ask such question, you have really you have an idea about this. If he loved the husband, mother, father, why he took the name according sequence wise, non-sequence wise, and why they took the name others one. Sometime patient left someone, for example, husband. A patient who visited me, how many members are there? He didn't the name of husband. So I asked him why. Your husband is not at home. Can you leave it? He is a problem for me. Why I took the because so I took the rubric stringent feel. Patient living with the same home, but this is a house. There she feel stringent. Okay, so I took the sense. Then I took the confirmed it after the more. Basically, it gives the idea to you and leading question. This is a lead to the further queries to go to the depth of the patient.
The family history.
Yes,
okay, thank you so much. And anyone, if you have question, you can ask, please. Dr. Danesh.
Good evening, Javed. Such a really a wonderful place from you. Nobody could believe that our album can do such wonders in such cases. Really, your case taking was entirely different from what we used to do, because most of the people used to take the case of the particular limb and particular area, because most since that the problem is paralysis, and naturally they will look into that way and find the remedy in that way also. So nobody could find the arsenic in that way. Otherwise, we may think of the side of the remedy. Sometimes the symptoms of present symptoms of the remedy, but this is a entirely different case taking, an entirely different remedy, and really a wonderful case, sir. Then No, what was the repetition?
Actually, it was
the
not
patient
repeated, sir.
required
Only single dose was worked over it. Arsenic album only.
6.
I have not repeated. There's no need of, because patient is going to be a progressing stage. Though, if the patient will stop over there, one thing I'm going to clear here. If you treat the such type of the aggressive type of disease, acute disease, or either chronic disease, meanwhile the patient was suffering from some other complaints, which are not related to this such disease. For example, migraine, headache, because some fever and some symptoms are related to the disease, but it was subsided. At after the second week, the patient was complained to me, sir, I have a headache. So I took another case for that, and only 1 or 2 doses are given. The headache was disappeared, and at that time, other medicine was also placebo over there. And after third week, patient complained me, I have a little bit cough. So cough was previously disappeared. And at that time, I have taken another case, recase of that cough only. That I given the 1 dose and cough was disappeared. Now I'm going to some hints about arsenic album. Arsenic album, if you choose arsenic album, it is very easy. It's a very beautiful tips. Arsenic album patients having all the vitamins and multiple medicines, other therapies medicine are placed in their cupboard. You used to see the YouTube channel. You used to see the whatever the social media. See what kind of vitamins we should take. What should we take? How to skin care? What is the doctors? And he will assure you. Should doctor you treat the patient such like that? And how much if you treated the patient, and what harms over there of your treatment? This is a typical question of the arsenic album. What harms with your medicine and treatment, and how much time it need to be cured? And another thing, patient was, I'm going to one thing here, patient was not assured because it's insecurities. If you say, no harm, patients go to the despair level. Doctor is not telling the truth. He will change multiple doctors. He will change 1 doctor, 2 doctor, 3. The arsenic album patient used to go here, many doctors, every therapist, whatever the kind of treatment, he will go here and there. If you see the handbag of the female, if you don't, you have a confusion, is it our arsenic album? You will see calcium sandose over there, multivitamins, different type of over there, other cosmetic treatment of over in their bag, and all the mobile numbers of the relevant therapeutics are in there. Many numbers are over there. This is a typical feature of the arsenic album. Yes, please.
Thank you, Dr. Danesh. And now it is Dr. Naveed.
You're welcome, Dr.
Naveed Awan.
Yes.
Good evening, sir.
Welcome, please.
Excellent follow-up, sir, and very excellent case taking. You have taken very appropriate rubrics, keeping in mind the mental state of the patients, as well as the observation and the therapeutic point of view. Excellent, sir. And we have seen the follow of the patient, how much he recovered soon. And that was the reflection of what was the patient was demanding from you, that I want to recover within 2 or 3 days. So carry desire to carry it fast. Excellent, sir. Excellent. Congratulations to you, sir.
Thank you, Dr. Naveed.
Thank you, Dr. Naveed. And now we have a question from Manjula. Why you selected one potency?
Actually, basically, one thing, what is the potency relation to the disease? If the disease having the such type of pathology, and you have to take the equals of the pathological level. Is it either it's a mind symptom or physical symptom? if the patient having the such terrible symptoms, which are equal to 1,000. So I have took the parallel. If I take the low potency or a more than higher potency, because this potency is very near to this, because it is not too much higher and it is not too much low. You can say it is a near to high. And if you take the low potency 6 and 30, it doesn't affect the patient because the depth of the pathology was too much. It's the aggressive type. I started with the higher potency and started from the higher potency, 1M, and it will work properly. And if it is needed, then I will go to more higher potency, not low then. Because if the patient, the condition of the patient, sometime we were deciding over there, in mind symptom, you are selecting the higher medicine. But if the pathology is too much deep, pathology is too much aggressive stage, aggressive, it's only deep only. For example, patient is a chronic patient, but having not patient, the disease is not aggressive like, then you can start from low potency. If the disease aggressive stage, the patient is anguish stage, agony stage, extreme restless stage, then you can take the higher potency. This is the logic of this. Please.
Thank you, doctor. And very interesting. How do you dispense the remedy? How do you dispense the remedy?
Okay.
Was it using water dose?
Yes, definitely. I used to place 3 or 4 drops in a half glass of water and give the 3/4 spoonful in 10 minutes interval. Once 2 3 spoons after 10 minutes and 10 minutes. It's basically why should we are doing basically it touches all the nervous, all the mucous membrane. Water will touch to the hole over there, and in 3 intervals. Why are selecting the 3 doses in 10 minutes interval? As you are familiar that if you made the medicine with the globules, which are made from the goat milk, because it does not dissolve in 30 minutes. Therefore, if you have chewed it, 30 minutes doesn't dissolve. You cannot bite it, you cannot crush it, and 30 minutes takes time. Therefore, if you take such a placebo, such type of the vehicle, and if the vehicle is not present, and then you can use in water. So I used water dose that is given to the patient.
Thank you, doctor. I think no more questions in the chat box.
Okay, this is the basically, please. Actually, one thing I'm going to clear it. As a number of the physicians and number of the research paper, if you see over there, here is some distinction in this case. One distinction is single remedy. Number 2 distinction is the 1 dose. Number 3 distinction is the severe acute aggressive cancer. Number 5, it is a multi-dimensional case. At one time, patient was suffering with the epileptic seizures. Number 2, it was the left side paralysis. Number 3 is cervical lymphadenopathy and lymphoid cancer, non-Hodgkin cancer. Number 6, it was cured, not palliate. It was not palliate, it was cured within a week. Why within a week it's cured? That is a significant. This is a normal thing, it is not an abnormal thing. If the patient who is an acute disorder, as you know, acute disorder leads to either patient will die or cure. No central line over there. Most of the patient of such diseases are going to be die. So I have decided over there, basically I know the depth of the disease, so the patient should cure within minimum time. This is the distinction of the case. So I got a result within 1 week. I have sent the patient to the PET scan. What is the diagnosis of the, you can say, what kind of test investigation for such diseases? CT scan, PET scan is a very beautiful test because all the organs, all the relevant portion of the scan over there. I advise the patient, but the report will comes after the 10 days. And the doctor, I talked to the doctor. He told me that there is no enlargement of lymph node, no aggressive. It was absolutely normal report. But physically, I did not collect the report. The PET scan advised after the 10 weeks. Okay, so one thing I'm going to clear here: this disease, aggressive disease, patient. What was the history of the before this IPR of the patient told me? When the patient was suffering from such problem, he visited to the oncology department and he started the chemotherapy. One session was given, and after that, because disease was so much progressing, and at that time, the patient started epileptic seizure and left side paralysis, and patient sent it to the neurologist. Neurologist told the patient, because this is a medical case of the oncology department, he referred again to the oncology department. And the patient visited over there. He said that I have referred to the neurology department. Patient was rolling stone here and go there, here, there, here, there. Then IPR of the patient, who was familiar to me. It was before this acute lymphoblastic leukemia was cured by his relative, and they visited. Then leave all the persons. Then I go to the Dr. Javed. I will consult him. Well, then they visited to me and they believe me. As IPR patient doesn't know about because he was terrible condition. Then he visited to me, and after a week you can see over there. However, one thing I'm going to tell you here, basically, normally in homeopathy, the patient are not sent it, not referred, or not even patient himself is not coming. Even doctor himself not a confidence himself. Should I treat such terrible disease or not? This is a very practically, I know it. This is a blessing of Allah that basically I know the pathology. I am physiologist too, and pathology is my subject. Both subjects are mine. I did work with gynae and ops and cardiology. I did a lot of work over there. Therefore, I don't have a anxiety and fear. What will be over pathology over there? What will be happen over there? I know I can transfuse the blood. I know the blood reactions and transfusion. I have water. I have the pathology, the blood transfusion. Everything I know it. I can manage all these things. If anything will happen over there, I know all these things. Therefore, I am aware of all these things. I know where I can decide where I should not. Where should I refer the patient or not? Basically, this is a very the doctor who must be aware the deep pathology function of the disorder. Therefore, he should take such terrible case. If he don't know the deep pathology of this, he shouldn't take such case. For example, if the case was a genetic disorders, here is another subtype who is a genetically disorders is coming, then you can't do it anything. Even with homeopathic medicine, there is need some other medicine that is a palliative phase. So as my knowledge is concerned, the physician must be fully confident and fully aware of. He should read out all the pathological reports with I mentioned over there, what is the genotype, what is the phenotype, and what is the staining, Sternberg cells, everything he must be aware of this. Astropathological finding, he must aware of all these things. So he will be able to understand exact function of this. In some condition, when you will give the medicine and what the reactions comes, what the outcome should come. If he know the pathology, then he understand it. If sometimes patients are taking other disorders, other systems, patients are butterflies. So what you can do with it? You know it, how it is metastasized the disease or not. Thank you, please.
Thank you, doctor. Thank you.